How to get your patients out of pain if manual therapy fails. I'm Dr. Michael Lee, founder here at The One Method. Thank you so much for checking in today. And the answer to this might actually surprise you, but I'm sure I want to ask this question to you, if it's okay. How many of you heard of the famous saying from Albert Einstein? Insanity is when you do the same thing over and over again, expecting the same result. Because if you're a manual therapist, whether you're a chiropractor, osteopath, physio, sports massage therapist, and you're doing all this manual therapy, massage, manipulation, whatever you may be doing, right? And the patient's still in pain. The question I'd ask you is, why are you still doing it? Because if you're still doing it and you're still hoping for a different result, well, I'm afraid you're probably, what Albert Einstein says, you're insane. Because ultimately, this is what I always say to people is, if you cannot get the result with someone, there is something you do not know. And if anything, yes, you can figure out yourself, but at the end of the day, it's going to take time. But the worst thing is going to cost you frustration, and it's going to cost you a lot of time with the patient. The patient's going to be in pain for longer as well. And those things you don't really want. And this is why it's so important. And we know as clinicians, we need to continue to develop our own tools, our skills, but it's not just, hey, go and learn this new thing, learn that new thing. It's actually, how does it all come together and how do we apply it to the patients? Then they get the instant results. But just think about this. How many times have you seen a patient that you might have had a scan, maybe an x-ray, an ultrasound, or even an MRI scan, and the report is actually, it's not too bad. But the patient is in 10 out of 10 pain. And you're doing all these different manual therapy things, trying to think, oh, it's a structural problem, there may be a little bit of scar tissue or whatever it may be, but they're still in pain. But this is where I need to challenge you and just say, look, a lot of clinicians, they look for the most minute, smallest bit, say 0.00001 millimeters of scar tissue. And say, yes, I found it. That must be the thing that's causing them 10 out of 10 pain. And I'll be honest with you, it's impossible. How can something so little create such an, exaggerated amount of pain? But we do need to think about this though. If someone is in that much pain and structurally there's nothing really that bad, there may be something structural, yeah, you have to treat it. But generally, if there's only something so minute, but they've got a lot of pain, the chances are it's not structural. But this is the problem with a lot of clinicians, of course. And you might have heard this saying, you only know what you know, but also you don't know what you don't know. And of course, people can only apply the tools of what they know. And when they're applying it and they're thinking, oh, it's not working, oh, I need to keep going, I need to keep trying. And I say, yeah, don't get me wrong, I applaud you for the perseverance. But the truth of the matter is at the cost of the patient. They're either paying you or they're either seeing you in the public health, but the greatest cost is still in pain. And no one likes being in pain. And from my point of view, I've never met a patient that says to me, hey, yeah, I want to see you to get me out of pain, but I want you to get me out of pain in a year. No one says that. They want to get out of pain when? Now. Immediately. And if you don't know how to get a patient out of pain straight away, there's something that you do not know. And this is where I'm going to show you today in today's live that I'm going to say, look, you need to widen your horizon. You need to see the bigger picture, because a lot of clinicians get so tunnel vision, says, oh yeah, I've learned this is what I learned at university, these are the things that I'm understanding the manual therapy stuff, and that's what I have to do. Yes, I would say manual therapy, I call it, is the fundamental. It's the most basic type of treatment, and if anything, it's a treatment that, yes, it can help with some conditions, but 90% of things it probably doesn't get to the root cause. So we need to actually find out, so what could it be? So we need to find out, okay, we need to get the connection between the brain and the body. And a lot of clinicians, they forget the brain because they think, oh, actually, I don't really understand the brain because I didn't really study at university, or more importantly, it's a bit too complicated for me. I'll be honest with you, it's not complicated at all, it's very easy. And yes, I had to study it, but ultimately, even just studying neurology or psychology and those areas, I still had to put it all together and find out exactly what is needed at the right time. So this is the thing, when you're seeing someone who's in chronic pain, someone's got pain for longer than 8 weeks, generally if someone is in pain for longer than 8 weeks, generally it's not a structural problem. The reason why is because whatever you break in your body, bone, ligament, muscle, tendon, it takes 8 weeks to heal. Right? After 8 weeks, it's healed. Now what? It should be robust. It should be safe enough. It shouldn't really be causing any pain. There won't be any inflammation. There won't be any bleeding. That's all gone. But unless you see on a scan, of course, it might be one of those that's got poor blood supply, or it might be a bit worse than what was first seen. But if there's none of those clinical indicators or clinical signs, it's not structural. So what can it be? It has to be neurological. So the question is, when people say, oh, it's neurological, if it's neurological, surely neurology is like strokes, people having dementia, Alzheimer, Parkinson's, those types of things, ataxia. I'm like, no. Every single person on this planet has neurological dysfunction. But it's just about on which part of the scale. Yes, you see further on the scale, like strokes and that, yeah, that's really extreme. But on the other side of the scale, these might be very small things. And this might be something like, oh, actually, I've got a little bit of numbness, or I've got a little bit of loss of coordination. I get a bit of a headache. I get a bit of, and these are actually all neurological issues. But the question is that, why do people always look at the structure? They think it has to be a structural, I have to do manual therapy to relieve those things, but actually it isn't. It's purely neurological. So one of the things that you need to actually figure out now is, actually, what do I need to do to learn the next step? But from my point of view, I only can tell you from my experience. And what I'd always advise you is, if you're going to learn anything, look at the person that has the results. Okay, so you may actually see that whenever I go and teach anywhere in the world, they always look at my results and go, hey, Michael, yeah, so you're the first clinician in the world to help a patient break out of locked-in syndrome. That's incredible, because no one's ever been able to do that. But most importantly, it's not just about helping someone who's completely paralyzed to move again. It's not just about moving. It's not just about walking. It's helping them run in 8 months. Now that is something special. And the question is, when I speak around the world, is how did you do it? Well, it's quite simple. I had to figure it out myself, because I had to fix myself, right? I was in a wheelchair for 2 years, and I had to think about, okay, what do I need to do to figure out why do I have a neurological problem? It's connecting all the knowledge and then being able to apply it in practice. There's a lot of knowledge out there. You can Google stuff, you can go on courses, but if it's not applicable, I tell you what, it's probably not worthwhile learning, because you need to be able to apply things and know it in a logical order. And this is why here at the One Method, we create that. We put all these different modules and say, okay, here's the manual part. Yes, you can do manual therapy. That will help in a lot of things. And then you do neurological, and that's the next step, because then you really get into the root cause of people's problems. And then here's the emotional traumas, where these are the deep-rooted traumas that are really kind of eating people alive every day. They're affecting their lives every day. And the question is, how do we get rid of those protective mechanisms and then give them the psychology to stop their body from breaking down in the future? But those are the things that we always look at. And we always look at treating the causes. We don't treat symptoms. We want to treat the causes, just so that it gives the patients that opportunity to not only live a healthy and happy life, but also to do all the things that they want to do, which was previously limited by pain. So I really hope that you found that this has been interesting, just kind of like a more of a conversation rather than me teaching you. But I'd love to teach you a lot of neurology here, but I mean, just in the 10-15 minutes that I have with you, it's not really enough to give you all of my 20 years of knowledge in this short bit of time. But if you would like to learn more about in terms of what we can do, in terms of you have patients with chronic pain, this is the next step you want to learn, of course, just put me in the chat, and one of our advisors will actually let you know when our next course is. But essentially, our passion is for the patients, and our passion also is to create world-class clinicians, the go-to clinicians, essentially, that they get the results that no other clinician gets. And it's just because it's been tried and tested over the last 20 years. So thank you so much for joining me today. If you'd like to know more information, let me know. And have a lovely week, and I look forward to seeing you next week. Bye for now.